Welcome to YouMeducates on cervical cancer. Cervix is a part of the female reproductive system that connects the uterus to the vagina. It has multiple functions which include: it acts as a barrier of bacteria from the uterus and other organs. During menstruation, it opens slightly to allow menstrual blood flow from the uterus. When a woman is in her fertile period, cervical mucus allows the sperm to travel into the uterus. During pregnancy, the cervix also becomes firmer, which helps to protect the fetus until birth. During childbirth, the cervix widens, allowing the baby to pass through the vagina. Cervical cancer is a type of cancer that starts in the cells of the cervix. In the Philippines, cervical cancer is the second leading cause of female cancer and is the fourth leading cause of cancer deaths among women. Almost all cervical cancers are caused by human papillomavirus, or HPV, a common virus that can be transmitted during sex. There are many types of HPV, but types 16 and 18 are responsible for majority of cervical cancer. Other risk factors for cervical cancer include giving birth to many children, smoking cigarettes, using oral contraceptives for a long time, having weakened immune system, and having many sexual partners. Early-stage cervical cancer may display no signs and symptoms. More advanced stages of the disease may include the following: vaginal bleeding, pain in the pelvic area, unusual vaginal discharge, pain during sexual intercourse. The most important thing to help prevent cervical cancer is to get vaccinated and have regular screening tests. The use of barrier protection during sex, such as a condom, also helps protect against HPV infection. The HPV vaccine offers protection against HPV, the virus that causes cervical cancer. On an April 2022 news release, the WHO recommended updating dose schedules for HPV as follows: 1 or 2 dose schedule for girls aged 9 to 14. 1 or 2 dose schedule for young women aged 15 to 20. 2 doses with a 6-month interval for women older than 21. The goal of cervical cancer screening is to detect cell changes and infection on your cervix before it progresses to cancer. Pap smear is a procedure that collects cells from your cervix, which are then examined for precancerous changes and abnormalities. HPV DNA test is used to check cells in the cervix for high-risk HPV infection. Cervical cancer can be treated in several ways, or a combination of the following: surgery, removal of cancer tissues or affected organ through an operation, radiation, use of high-energy beams to kill cancer cells, chemotherapy, use of special medicines to kill cancer cells. Let us discuss some myths and facts about cervical cancer. Myth: cervical cancer only occurs in less developed countries. Fact: cervical cancer affects people in all countries, developed or not. It tends to be more common in less developed countries because there are no organized cervical cancer screening programs. Myth: I don't need screening because cervical cancer does not run in my family. Fact: most cervical cancers are caused by certain types of the human papillomavirus. HPV is spread by skin contact during vaginal, oral, or anal sex with someone who has the virus. The lack of family history of cervical cancer is not a predictor of cervical cancer and is not a reason to skip screening. Myth: you are more likely to get cervical cancer if you have had multiple sexual partners. Fact: you can develop cervical cancer even if you have only had one partner. Myth: if you have HPV, you will develop cervical cancer. Fact: there are more than 100 types of HPV. Some types are high risk for cervical cancer, while others are not. Some types may cause genital warts. Usually, the body's immune system clears the virus by itself within 2 years. However, for some, the HPV does not clear from the body, and over time, it can cause abnormal cell changes in the cervix which can develop to cancer. Myth: cervical screening tests for all gynecologic cancers. Fact: cervical screening only tests for cervical cancer. It does not screen for other gynecologic cancers like that of the ovary, fallopian tube, and uterus. Remember, cervical cancer can be prevented through early detection. Talk to your doctor about getting HPV vaccine and cervical screening.